Therapy for refugee children.
The purpose of this group is to prevent psychological morbidity among refugee children by improving their social and emotional skills, decision-making skills, self-regulation, and increase their sense of self-efficacy. According to Faisal and Stein, refugee children are at a significant risk of psychological morbidity, especially PTSD, depression, and anxiety due to their experience of coming from a war zone and adjusting to an unfamiliar culture. They suggest the two main areas of supporting refugee children's mental health needs are by providing appropriate support to children experiencing psychological difficulties and prevention strategies. In addition, Faisal and Stein mention that refugees are at higher risk due to the stages of traumatic experience they had. The 3 stages of traumatic experience are first, while in their country of origin. They experience considerable trauma by being forced to be displaced from their home, witness and victims of violence, experience grief and loss of family, disruption in education and parental care, and these children may have no memory of a period of stability. The second stage is during the flight to safety. They can experience further stress by separation from parents, either by accident or strategy to ensure their safety, being placed in settlement camps for months or years, or being placed in smugglers' hands with parents hoping they have better chance of surviving alone. Finally, the third stage is when having to settle in a country of refuge. It is added difficulty to integrate into a new society, which is called secondary trauma. They could find challenges in settling into a new school, finding new peers. They may have to assume an adult role to help their families with the language barriers. They have higher risk to experience other behavioral and emotional issues due to the trauma they have experienced, besides PTSD, depression, and anxiety disorders. The targeted population are elementary Syrian refugee students. This population would benefit most from this program due to their experience immigrating from their home country to America due to the war. This population also needs support due to the educational difference from their home country in learning to balance their 2 cultures. A quick history of the Syrian conflict began in March 2011 and has displaced nearly 12 million people. Approximately half are under the age of 18 and around 40% are under the age of 12. Because the conflict recently began, the literature on Syrian refugee children and their outcomes remain limited. However, there was one study conducted in Islahiye camp in southeast Turkey. They reported 79% of Syrian refugee children had experienced death in the family, 60% witnessed violence, which is getting shot at, physically hurt, or kicked, 30% had been victims of this violence, and 45% displayed symptoms of PTSD, while 44% reported symptoms of depression. The population served are male Syrian first grade to second grade refugee students. These clients have been identified with disruptive behaviors in school and after-school programming at Syrian Community Network, which is a partner of my agency, Asian Human Services. The group will have a limit of 7 participants to maintain the effectiveness of the group and have a ratio of 3:1 participant to facilitators. The duration of the group will be for 1 hour, once a week, for 10 weeks. The intervention utilized will be therapy. Facilitators will create a structured curriculum to facilitate consistency for participants. Therapy is an interactive playgroup for social skills and emotional skills development. It will consist of check-ins and check-outs for their feelings to increase their understanding and expression of their emotions in various plays modified to their developmental level and cultural sensitivity to practice healthy interactions and attachments. Columbia Impairment Scale for both child and parent versions will be used to evaluate the participants' progress. The parent and child will complete this assessment during the intake process and will complete another assessment after the program has completed. This is a sample agenda for the group. There will be a consistent structure to the group with varying activities. The check-in process is to help them build their emotional literacy and allow them to communicate their feelings. The group activity are games divided in individual, pair, and group levels. The individual level is focused on increasing their self-awareness of their thoughts and feelings, and understanding the connection between their thoughts, feelings, and actions. The pair level is focused on increasing their communication skills to each other and understanding people's personal space. Lastly, the group level is for increasing decision-making skills while working in a team and empathy levels. Finally, the checkout is a space for them to provide feedback to the group about their experience. The expected outcome of this intervention are parents will see an improvement in participants' behavior at home, there will be less disruptive classroom behaviors, and there will be an increase in self-advocacy. Finally, participants will be able to create and maintain healthy social relationships, improve their decision-making skills, and demonstrate ability to identify their emotions to others. Lastly, our recommendations for this research. Obviously, there is a need for a collection of data. Due to COVID-19, we were unable to continue the research, and there needs to be results section. Further research about the effectiveness of TheraPlay in a therapeutic setting is needed. TheraPlay was designed to be used in schools, specifically early childhood setting. The selection of participants and more diversity in sample population due to these participants being identified by partnered organizations who are all Medicaid recipients, and it will be interesting to see refugee children from other countries and how this could help them. And here are my resources.
Thank you for watching, and I hope you have a great day.